Hello everyone, you're watching Physio Classroom channel, and in today's video we are going to discuss in detail philosophical tenets of NDT or Bobath therapy. Now philosophical tenets refers to principles or beliefs that serves as the foundation of the entire NDT practice model. If a therapist wants to practice NDT as a whole, then he or she must treat patients based on these NDT global beliefs. So let's start discussing the philosophical tenets one by one with practical examples. The first philosophical tenet states that NDT therapy works, and I have explained this in detail in my previous video of NDT therapy series, which was a tribute to the legendary therapist Berta Bobath. We now have very good quality of evidences and many good researches which have shown that physiotherapy can indeed bring significant improvement in the functional independence, quality of life of neurological patients. And a NDT therapist should always have this state of mind while treating the patient, that if I can assess right, evaluate right and treat right, then my patient is going to become better. So the first philosophical tenet is all about believing in yourself and believing in physiotherapy. The second philosophical tenet of NDT states that we should always treat the patient as a whole. Now we have to always remember that we are not treating a particular part or a particular problem in our patient. Every patient is a unique individual with different sets of problems, and every patient will be having some likings, dislikings, expectations from the therapy, and these all things must be considered while designing and planning the rehabilitation for the patient. Now let's understand this with an example. Now let's say we have a patient here, Manisha, who is a 24-year-old female and who developed right upper limb monoparesis after stroke. And the patient has come to a therapist. Now let's see how a NDT therapist and a therapist who does not practice NDT will treat such a patient. Now let's say I am a therapist who does not follow the principles and concepts of NDT, and this patient comes to me with the problem of weakness in the right upper limb. So I might first evaluate the strength in the right upper limb and then design some active assisted exercises for her. I might also give her some pegboard activities or some other instruments available for upper limb strengthening in my physiotherapy OPD. But if I have to practice NDT, then I must think that I not only have to improve the problem here, but I also have to address the person as a whole. So I have to interview her thoroughly and know her likings and dislikings and her expectations from the rehabilitation. Now she tells me during the interview that she is very fond of cooking and runs a cookery channel. So now this is very valuable information based on which I can redesign my entire therapy. The patient can be asked to mimic various cooking actions like cutting, chopping, stirring, and I will observe the patient, handle the patient and help her to perform all those activities. Now there are many things that needs to be discussed here regarding the therapy program, but because in this video we are focusing more on the philosophical tenets, we need to restrict ourselves with the explanation. So in short, our therapy program should never be stereotypic or same for every patient of same condition. We should always consider the individual, the likings, dislikings, the expectations and incorporate them into the therapy program. The third philosophical tenet of NDT states that we should always build on the patient's strength while addressing their impairments. Now as a therapist, it is our duty that we should not only focus and make list of the patient's problems, we should also make a note of patient strength in terms of participation and functions. Now for example, I have a patient of stroke who is a left hemiplegic. Now I make a list of the impairments, which can be poor motor control of the upper limb and the lower limb, increased tone, reduced range of motion and so forth. But at the same time, I also have to think about what positives or strengths this patient has. Is my patient more motivated? Is my patient relatively a younger stroke patient who has higher potential to improve? Or is my patient very much keen to go back to work? Now all these things should also be taken into consideration while designing the therapy. Now in short, every individual has a component of health along with the component of disability. And while practicing NDT, it should never happen that we only focus and address the disability component and ignore the health component. The fourth philosophical tenet of NDT states that the therapy should always be individualized for every patient. Now, NDT therapy intervention is always based upon thorough evaluation of the patient based on the ICF model, which is the International Classification of Functioning Disability and Health. Now, individualized therapy attention is important because every patient is different, every therapist is different, and every environment is also different. If a patient is being treated in a physiotherapy OPD and if the same patient is being treated at home, then similar form of treatments can't work and they have to be modified based on the change in environment. Therefore, the fourth philosophical tenet that therapy must be individualized should be taken into consideration by a NDT therapist. The fifth philosophical tenet of NDT states that one should always treat in the past, present, and future. Now, a thorough family and personal history should be taken and some key points should be noted down. Like, for example, for the past treatment, one should note that what were the hobbies of the patient, where the patient used to do the job, what were his relations with the family members, and so forth. To treat in the present, one should always consider the current motivational level of the patient, the behavior of the patient, the treatment environment in which the patient is being rehabilitated, and for the future points, the therapist should take into consideration what the patient wants to do in future, what the patient wants to become in future, and most importantly, where the patient is going to go once the therapy is over. Like, for example, a patient who is going to go in an old age home after the rehabilitation, the therapy have to address certain different issues. And if the same patient is going to go in his own home and is going to live with the family members, then the therapy has to be modified accordingly. The sixth philosophical tenet of NDT states that teamwork is critical for best care of the patient. Now, a patient is not only getting treated by a physiotherapist, the patient might also be seen by an occupational therapist, a speech language therapist, and other rehabilitation workers. Now, it is very important that we exchange the evaluation and the treatment progress of our patient with other rehabilitation team members. And in this process, we will be able to get many new informations based on which we can modify our treatment for the betterment of the patient. The seventh philosophical tenet of NDT states that typical development provides the important framework for NDT examination and intervention. Now, since the development of the Bobath therapy, NDT therapy has grown many folds. In the earlier times, when therapists used to practice Bobath therapy, they used to assess their patients based on the typical developmental sequence. Now, if a patient is able to roll and go to prone but is not able to crawl, then the therapist used to treat the patient more in the crawling position first before making the patient sit. Now, in the current NDT therapy practice model, it is more about addressing the impairments of the patient while addressing and restoring the postures and the movements. The eighth philosophical tenet of NDT states that active carryover of therapy through daily life is very important for best care. Now, if I am treating a patient and addressing the problem of the upper limb and lower limb movements, I also need to ensure that when my patient leaves the clinic and goes back to home, those improved movements should be utilized in carrying out the ADL activities. And through that process, the learning can become permanent and the motor control can become more successful. The ninth philosophical tenet of NDT states that NDT is a hands-on intervention process to enhance functional outcome. Now, I always emphasize on this particular point while seeing the patient and teaching my students in the rehabilitation wards. I always encourage to use their both hands to give maximum cues to the patient about what needs to be done and how it should be performed. A therapist will find it very difficult to practice NDT without knowing how postures and movements can be altered and improved through handling techniques. A therapist should always try to develop good handling skills and must utilize them whenever treating the patient to enhance the functional outcome of a therapy. I will be making a separate video to discuss and demonstrate handling in detail, but for now I can give you all a very interesting example. Now we all must have experienced the very first time we tried to ride a bicycle. We were very much afraid of falling and we had no clue of what to do. Now there was this person in the form of father, elder brother or someone else who was there with us, who made us ride the bicycle, who made us understand what needs to be done when the bicycle goes on the left and what needs to be done when the bicycle goes on the right. From where were we getting all these informations? These all informations were reaching to our brain through the hands of the person who was helping us in riding the bicycle. Now these handling techniques are very good to give this afferent sensory information to the brain, to make the brain understand and rewire itself or reprogram to perform a particular function in a more effective manner. So these were all the important NDT philosophical tenets one should be aware of while practicing NDT therapy. I sincerely hope that the information shared by me in this video is going to be helpful for physiotherapy students as well as young practitioners. Do utilize this knowledge while designing NDT therapy for your patients. And most importantly, don't forget to watch the hemiplegia rehabilitation series, in which I have already made 13 important videos which are also based on the concept of NDT Bobath therapy. See you all in our next video. Till then, keep learning, keep sharing and stay connected.